to the first lecture of our class. The class exercise, advanced exercise physiology, focusing a little bit on pathophysiology, trying to understand different conditions. Again, introduction, if you watch the syllabus, short little syllabus video, Dr. Richardson, and I am a clinical exercise physiologist. I know that many of our students are going to more go into what we call the applied route. Applied physiology would be someone going into coaching, strength and conditioning, working a lot with a healthy population. Many of you are looking at maybe the direction that I put my career in, which is more dealing with people that have risk factors and chronic conditions. Whichever angle you're going, I think a really good way to understand who we all are in this class, especially since we're learning from our homes and not in a classroom, is I want to understand where everyone's coming from. So I'm going to go through this basic of what are some career options. I'm sure you've heard something similar to this before, but it's really going to help me to understand when I take a look at the discussion thread this week, what I really want to be focusing on. I want to make sure, yes, I have my subjects I'm going to cover and understand how to work with people with these different conditions. But I think it's more important if we can personalize it a little bit. So when you take a look at exercise physiology, we know there's a lot of different pieces of the puzzle, right? There's health and fitness, which is kind of the fundamental piece of it. We've got sports management, so coaching and administration and ticket sales and promoting of athletics, lots and lots of things, right? Coaching and sports education, so being in schools, in rec centers, teacher education, physical education, and we've got therapeutic exercise. So prescribing, this is more the clinical route, this is more the applied route, right? So which direction are we going? I feel like we have a lot of students going applied, and many of you in this class already know our personal training on your own. That would be an applied aspect. Therapeutic is more, again, working with people with chronic diseases. And then we've got all of these other things we've got to be balancing. So your own experience to physical activity, professional practice, what organization you're certified through, reading up on evidence-based scholarly work. Really, they're all going to be grounded in making sure there's a theoretical and fundamental proof that we're really using research for what it is. So your classic professions, your areas, we have people that go into group exercise, fitness, health and fitness counselor, personal training, fitness directors, specialist positions, so certified health educator, clinical exercise physiologist, registered dietitians. There are so many. And I will tell you right now, sitting here at this slide, there are multiple senior living, assisted living, nursing homes that are looking for what we call it, you would originally have called it a group exercise instructor that can work with people through Zoom. So many of our aging communities are locked down due to the coronavirus, and I do know if you are got a decent personality, you know basics of group fitness, and you're a pretty decent technology with Zoom, you can definitely find yourself a job remotely from your own living room helping some of our aging stay active. Just put that plug in for you. So some of the different careers. So I've got here on the one side, careers in health promotion. So certified personal instructor, YMCA, manager, director, and then careers in the hospital. So cardiac rehab, pulmonary rehab, diabetes education, cancer rehab, cardiovascular, nutrition education, all of these kind of promoting to stay healthy. We call this a primary prevention route. So those are primary prevention, people without disease. And then the careers in the hospital, we call those secondary prevention programs. And again, it's a matter of your preference, what kind of population you like working with. Sometimes it's just a matter of what jobs are available and where you end up landing something. Nonprofit is another area that I've seen a lot of our students work in. And if you've ever had Stephanie Davis, when she was out of school, she did a lot of nonprofit work. I just name her because some of you may have had her as an instructor. But all of our nonprofits are going to use nurses, social workers, exercise physiologists. They really try to have a good multidisciplinary group of people that are working behind grants to get things going. I have had students end up in DC working on grants. So if you look at some of the government job sites, they're looking for a master level student that can do basic data entry and research, and they're usually pretty decently paid positions. So again, some of our government jobs are usually out of the bigger cities. They're not grant funded. A lot of them are going to be nonprofit, but it's a place that a lot of professors, advisors, Students themselves don't really think to look. And again, there's a really decent salary that can come out of there. Corporate health, so businesses that would employ you to be their health promotion wellness coordinator. And this is just a list of some. I mean, this is a short list. Here in town, prior to the pandemic hitting, Sterling Jewelers had a really big wellness program. Goodyear down the road, they have a full-time wellness coordinator. She actually got her degree here at Akron. Timken, NASA up in Cleveland. I mean, big employers, as I have listed, will employ Summa Health System, will employ people like yourselves to run an employee wellness program, right? So that's what we call corporate health promotion jobs. There are a lot going on right now online. You all know that I was recently unemployed by the University of Akron, so I'm really abreast of what's going on. And if you're familiar, there's a lot of new online fitness platforms where you download an app, right? Digital fitness, and they need smart people like you guys behind the app. So you can be crafting your home for fitness, working in a health promotion setting, but doing it more behind some of those big apps. So that's another career to think about. The bottom line is you have chosen this major because you are vested with helping others, right? You are intrigued by how the body works. You're probably pretty active yourself. You've seen the benefits of exercise and you want to help others, right? That's kind of what we're looking at. When we think about physical functioning, this color coding kind of lets us know, right? So no physical activity, right? That's coded yellow, right? So yeah, they need an individual behavior change. Moderate vigorous activity, vigorous physical activity, right? That's at the individual level. Then we look at the organizational policy level. Physical activity requirements in schools, bad. It's falling down, right? I mean, even before the pandemic, we have more and more time being pulled away from physical activity. Access to school physical activity facilities going down as well. So we're seeing less and less minutes out of a chair in all schools across the nation. We have less investment in phys ed and health teachers. It's a huge problem. Then you look at the environmental intervention program. So participation in daily activity in schools, physical activity in class, and TV watching, TV viewing. So these kind of are color coded. As you see, we haven't met any of them, but this is kind of a little bit of an activity to say, looking nationally, where could you, with your interest in helping people live healthier, find your niche and where you're going to end up getting a position. So expanding the scope of what many schools call this kinesiology, right? Expanding the coast of where people end up getting jobs, right? So the scope of work is expanding, very much more multifaceted, physical, intellectual, emotional, social, and spiritual dimensions. I mentioned nursing homes, as there are children that need more physical activity. We have old people needing more physical activity. We have workaholics, middle-aged people being stuck at their desk in front of a computer that they need to, we're seeing increasing obesity, more low back pain, little kids being diagnosed with type 2 diabetes, right? We really are at a level of what I would call an epidemic, and we're going to look at this in the next few weeks. I'll spend a lot of time looking at obesity. So health and fitness settings, so worksite settings, early programs were very narrow, only for the employees that work there. And then in the 90s, they started doing more. They added more to it. Instead of it just being, are you smoking, what are you eating? Basic ergonomic workstations, right? So are they sitting at a desk and how efficient is that? Elaborating, outsourcing, so it wasn't just one little room in a business, but outsourcing to other fitness facilities, so people didn't use the excuse that they wanted to exercise near their home and not near their job, and they wanted to bring their family with them. So there's been this evolution of what do employees need in a worksite office, and how do we help them engage and really adhere to the plan. So employers have found that health and fitness programs, what do they find? Reduce healthcare costs. So the employer is going to hire you because we're going to get those employees to be healthier, and it's going to cost them less money, right? So their cost is going to go down, right? So they're not charging as much to the insurance, the health insurance plan. But on the flip side, the productivity goes up. People are happier, their mental outlook, their quality of life, productivity, morale, not missing as much work, so absenteeism. So really a good benefit. And there are many businesses in Akron that are fabulous with this, and there are many businesses that are horrific where people are overworked and stressed, and you see both ends of the spectrum. There's not as many good ones. We need definitely more good ones. There's been lots of studies. This is one big one that's been cited a lot, found that those who had healthier body weight, calculated by basic BMI, right, healthier BMIs, had fewer absent work days and decreased healthcare costs. So there's been lots of studies. That's just one. So what fuels a company to hire somebody like yourself is data, right? If we can show that we can get someone on a 6-month, a 9-month, a 12-month program, diet, exercise, smoking, stress, they start feeling better, and then we need to document that their work productivity is going up, they're not calling off work, all of those good things. So our settings can be in the commercial setting, so sales, for-profit businesses, or in the clinical setting, work in partnership with both medical-based fitness facilities, with health insurance partners to try to really manage so there's not as much expensive medical expenses because people are healthier. So I am sure that at this point in your education, none of this is that new to you. And that's okay. It's only, lecture one. But as you get close to graduating, or you get close to thinking, where do you want my internship to be in? Where are you going to go? You need to do something different. Your internship needs to be something, especially at a graduate level, different than what you did as an undergrad. It's got to be different than what you're doing every day on your job. You really want to expose yourself to something that gives you another identity, so when you go in front of that job interview, you're going to be more lucrative. So community settings, here in Akron, especially now with the LeBron James School, there is lots of potential. I know some of the professors that work over in LeBron James, whatever the full name of it is, school, lots of programming for kids and families to stay healthy. They do diet planning, they help them with meal shopping, how to educate families, and then how to get the kids more active. So that's just one here in right here in the city, but the YMCA's, the American Heart Association, more and more focus has been on trying to decrease childhood obesity. So that is a big one. So, pediatrics in urban cities is a big one, but we also have this whole aging, right? People are living longer, but they're unhealthy. So how do we help those that are hanging around in nursing homes that really their quality of life is not as good? So when you look at where the careers can be, right? So we've got commercial fitness, multi-purpose, clinical multi-purpose, nonprofit, which is very big, and then miscellaneous. Many people end up in careers in, like I mentioned in the last slide, sales, in marketing, in any of those realms as well. Group exercise instructor, right? So may not be what you aspire for, but maybe a good side gig for a little bit. I know when I was in grad school, I knew nothing about group exercise. It was not my thing, but I got a job being the step aerobic teacher. No certification, no background, but they hired me. A local hospital wanted an evening step aerobics instructor for phase 3 cardiac rehab. And before you know it, I quickly had to learn and get myself pulled together and learn how to do group exercise. But it led to a really interesting kind of door opened in the hospital by these patients. They loved what I was doing. Their group started expanding, and I got a few other grad students on board helping me. This exists. And I know this is not why you're sitting in grad school today, but if you could right now during a pandemic lead some exercise classes, feel comfortable enough to lead others and motivate and cue and music and all of that good stuff from your computer, you're really going to have a pretty impressive resume. And bottom line, you're going to be affecting a lot of great lives. So think about this, right? Think about how many people we know that are sedentary, sitting on their couches, sitting in nursing homes, sitting in their own family room, that need somebody like you, your energy, your drive for fitness, to be able to reach out. And I guess because the pandemic makes these recorded sessions much easier than ever, that's the thought. If you don't want to be in a room, doing a country line dance to it with a Zumba song on, that's okay. You don't have to aspire to be a Zumba teacher, but just know that sometimes that just is a little bit of extra on your resume to help get you in. Fitness instructors can be of all different bachelor's, master's, many different, focus. I've had students go on. I've had a couple of students go on to work in prisons and some of the local jails, helping, if that's your thing, if that's, a population of people that you are passionate to help. There again, it's kind of an interesting way of being a fitness instructor, but they do exist, right? There are ways of many cities and many states spend a lot of money on incarceration, on trying to rehab the prisoners so they come out more effective, and exercise is often used. That might another be an odd thing to share with you. That's not as typical as, just going to your Fitness 19. There's also a lot of adapted fitness. So you can get an adapted certification for dealing with people with adapted needs, so wheelchair and amputations. Prior to, again, I'm going to mention a bazillion times, right? Akron giving me the boot. I took my students all the time to the Veterans Hospital, and we have one in Akron, and there's one up in Cleveland, and there is a support group for people with vision problems. So, vision disease, so eye issues. They have a really tough time seeing, and I would always make my students lead them through exercise. So do group fitness for people with low vision. It's very difficult because they are solely listening to what you say and not they're not watching you, they're listening. Incredible results, for very reciprocal results. So obviously the veterans really love it. They love students. And then our students, I mean, I have so many thank you letters from students for exposing them. Actually, some of my students have gone on, this is a tangent, gone on to get another master's degree in low vision rehab. So there are lots of jobs out there for somebody like yourself to be in low vision rehab. So you're helping people who are newly diagnosed with many, many different eye issues learn how to live and function. So anyways, I will give you lots of tangents of great information of where you can find your niche of how your love for exercise can fit into being a job. Basic counselors, fitness instructors, kind of one more level is somebody who is not just on a fitness floor with healthy people, but more that counselor is where you're meeting with them, you're setting goals, you're recognizing risk factors, you're coming up with health interventions, behavior change, relaxation, smoking cessation. So this one usually comes with a little bit more experience, again, in some of those online apps that you're seeing advertised.